Welcome to the Idea Exchange podcast. In today's episode, we are talking more about liver failure. I'm your host, Wes Piri, and our guest is.
Vincent Chilemba.
Welcome.
Thank you.
And what is liver failure?
Liver failure is a condition where the liver loses its ability to function properly. The liver is an organ found in the abdomen, the upper abdomen, on the right side, and it is involved in metabolism, synthesis, storage, and detoxification. So metabolism is breakdown of compounds, could be drugs and other organic compounds, including toxins. Synthesis is the production of compounds. Could be enzymes, it could be coding factors and other proteins. Storage is a storage organ for glycogen, for uh, other metabolites, and even fat in sometimes. Detoxification, that's metabolism of toxins. So most of the toxins and most of the drugs and other external inorganic compounds are metabolized or deposited in the liver.
What are the different types of liver failure?
Clinically, liver failure is classified into two broad categories. The classification are made based on a clinical course. The first one is acute liver failure. This is a sudden and rapid impairment of liver function. So this happens this presents typically in a course of a week to uh, in a course of days to some weeks. The other type is chronic liver failure. This is gradual loss of liver function over months and years. So chronic is to do with the timing. So chronic liver failure happens slowly over a longer period. Acute liver failure happens suddenly and over a short period.
How common is liver failure and which population are most affected?
Currently, there are no specific and accurate numbers to quantify the cases of liver failure in Malawi, but liver failure is definitely common, as it is an endpoint of a number of healthy conditions. So most healthy conditions that might affect the liver or other organs can have liver failure as the endpoint. So these conditions could be like alcoholic liver disease, fatty liver disease, hepatitis. So all these conditions they might complicate into liver failure.
What are the primary causes of liver failure?
The different types of liver failure, that is chronic and acute, they have different primary causes. So I'll start with causes of acute liver failure. The most common cause of acute liver failure is paracetamol overdose. So paracetamol is a common over-the-counter medication, commonly known as Panadol in our setting, and some individuals might overdose paracetamol in an attempt to commit suicide. And uh, paracetamol is metabolized by the liver, and overdose of paracetamol might damage the liver, causing acute liver failure. Uh, Another common cause for acute liver failure is idiosyncratic drug reaction. So these are drug reactions that are not common, or that do not happen in the majority of individuals and are not really understood on how they work or how they affect how they affect the liver. Other causes for acute liver failure, hepatitis A and B, ischemic hepatitis. So ischemic hepatitis is when there is reduced perfusion to the liver, or an autoimmune. Autoimmune is when the body's own immune system attacks the liver. On chronic, the primary causes of chronic liver failure are chronic liver diseases. So these are conditions that affect the liver and they have a longer clinical course. These conditions include cirrhosis, hepatitis B and C, alcohol abuse, or alcoholic liver disease, malignancy. So malignancy is a abnormal growths in the liver. They might be cancerous or they might be benign, and also fatty liver disease in some cases.
How does liver failure impact the quality of life and overall health?
So typically, since the liver is involved in metabolism, when the liver fails, uh, energy metabolism and metabolism of other compounds in the body, they are affected. So typically a patient might present with fatigue. So a fatigued patient cannot do regular work, especially uh, chores that are involving, as they might get tired easily. So this might affect the quality of life. And the metabolites that might collect in the liver or that might be released from the liver during liver failure might cause uh, uh, encephalitis. So this is swelling of the brain. So usually this is associated with accumulation of ammonia. Ammonia is released in many of body's metabolic processes, and it is metabolized by the liver and eliminated by the kidneys. So when there's liver damage, ammonia might accumulate in the body, causing encephalitis, and this can cause different presentations. And also, uh, liver failure can also be associated with breeding tendencies, as most of the clotting factors are produced by the liver. So when the liver fails, there is reduced production of clotting factors, and in these individuals, when they have a bleed, their body might fail to stop the bleeding by forming a clot, and at the end they might end up bleeding out, and in more severe cases they might die from overbleeding.
How do lifestyle factors contribute to liver failure?
So some lifestyle choices might directly affect the liver. So, for example, alcohol abuse. Alcohol abuse has been associated with alcoholic fatty liver disease. So this is the deposit of fats in the liver due to excessive alcohol consumption. This usually happens because when there is so much alcohol in the body, it can be used as an alternative source of energy. And instead of breaking down other sources, which might be fat or which might be converted to fat for storage, and the fat might be deposited in the liver. Also, cirrhosis or some healthy, some lifestyle choices that might put an individual at risk of developing hepatitis, like injectable drug abuse, or also other lifestyle choices that might put the individual at the risk of fatty liver disease. So this can be excessive weight gain and obesity.
What role do genetic disorder play in liver failure?
Some genetic disorders. So these will be disorders that directly affect the liver, either by overproduction of some metabolites or by accumulation of some compounds. For example, there is hemochromatosis. This is a genetic disorder that is described as an accumulation uh, that is described as the abnormal metabolism of iron, and due to this abnormal metabolism, iron accumulates in the body, and most of it accumulates in the liver and might end up causing liver failure. And some other genetic disorders that affect metabolism of other minerals like copper can also lead to deposits of copper and other minerals in the liver.
How do environmental toxins affect liver health?
So environmental toxins might deposit in the liver. Uh, so most of the times when someone is exposed to to toxins, they are taken up to the liver for metabolism, and these might deposit in the liver, affecting the liver directly, or maybe they might be taken to the liver for metabolism and produce metabolites that are toxic to the liver, and this might directly contribute to liver failure.
How is liver failure diagnosed and what tests are used?
So the diagnosis for liver failure is usually clinical and laboratory based. So the clinical part, you do the assessment of symptoms and a physical examination to check the possible causes of the symptoms. And when liver failure is suspected, you can go ahead and do some laboratory diagnosis. Laboratory tests rather. So these tests might check the liver function. So you might check plasma proteins. Might check enzymes in the blood. You might check prothrombin time and activated partial thrombin time. So these will check directly the concentration of clotting factors. You might also check for bilirubin. So you can check for both conjugated and unconjugated to check the metabolism of bilirubin. You can also do tests to look for hepatic malignancy markers. So these are markers that can be found in the blood, indicating that there is a tumor in the liver. You can also test for infections like hepatitis A, B, C, and D, which can cause acute and chronic hepatitis.
Alright, what are the common misdiagnoses or complications of liver failure?
The common misdiagnosis might be genetic conditions. So this might be genetic condition that might cause liver failure. So most of the times genetic genetic disorders are not so common, and they tend to be overlooked. And most of the times when they happen, there might be a misdiagnosis. Also, sometimes when there is malignancies, and also when there is encephalopathy due to buildup of ammonia from other sources which are not linked to liver damage.
What are the most effective treatments for liver failure?
So the most effective treatment would be treating the underlying cause. So you have to try to find what specific condition is causing the liver failure and treat the specific condition. You can also give supportive care to the patient as you wait for the specific diagnosis. You can also give medications like lactulose for hepatic encephalopathy. So this will help in elimination of ammonia to reduce the symptoms of hepatic encephalopathy due to ammonia buildup.
How does lifestyle modification impact liver health?
So some lifestyle modifications can help uh, uh, with liver health or can deteriorate liver health. So some lifestyle modifications like exercising regularly, having a good diet might prevent and help manage diabetes, which can help manage liver, might help improve liver health. So some other lifestyle modifications like alcohol, which directly damages the liver, and reducing intake of alcohol might improve liver health by reducing the impact of the metabolites on the liver. And general being and physical health can also improve the can also improve healthy of the liver by reducing its load, its metabolic load.
What role does hospitalization play in severe liver failure cases?
So when liver failure is so severe, there might be a need for hospitalization. So this allows for critical management. So critical management will involve more advanced techniques to look after the patient and to help them get better, and can also allow for supportive care and for treatment to be initiated at the hospitals. It also allows for more detailed monitoring, and in this case, this way you can avoid complications and manage them if any will come up.
What are the benefits and risk of alternative therapies?
So there are a number of alternative therapies for liver failure, like herbal medicine, diet and nutrition, or lifestyle modifications. So they have different benefits and needs. For example, herbal medicine, uh, it, it's relatively cheaper and accessible, and most people they are more comfortable. Not most people, some people are more comfortable receiving herbal treatment than a typical medical treatment. On the other side, uh, it is not really evidence based. There is lack of evidence to support the activity or effectiveness of the herbal medicine, and there are also lack of proper guidelines on how to use the herbal medicine. On diet and nutrition, when the adjustments to diet are made based on evidence, they can they can be good. They can benefit and improve liver health, but on the other hand, uh, they might not be efficient. They might on their own they might not work to eliminate the core cause of liver failure. And on lifestyle modifications, when they're justifiable or when they're proven to work, lifestyle modifications done, this might help manage liver failure and reduce the symptoms.
What dietary changes can help manage liver disease?
So you can start a low sodium diet. This will help. This will reduce water retention and reduce symptoms like ascites and edema. You can also initiate a balanced diet, which improves the liver health and general physical health. You can also reduce alcohol, which has been proven to directly damage the liver.
Alright, how does exercise impact liver health?
Exercise can help maintain a good weight. So when someone has a good weight, they have a proper composition, like a proper distribution of uh, fat and muscle, and this can reduce uh, conditions like fatty liver disease, which are implicated in liver failure. Can also help increase insulin sensitivity and increase metabolism in general. So this can reduce diabetes and can also increase the liver's ability to metabolize some compounds. It can also help to reduce fatty deposits. So when you exercise regularly, you might burn up some fat, and this can reduce the occurrence of fatty liver disease and alcoholic fatty liver disease.
What role does stress management play in liver health?
So managing stress in a patient with liver failure or in liver health in general would be mostly the improvement in quality of life. So when someone has their stress levels managed, they have a better health or better quality of life, and they are less likely to be involved in uh, drug and alcohol use abuses, which are implicated in some liver conditions that might lead to liver failure.
Are there any specific supplements or vitamins recommended for liver health?
Research has shown that vitamin B, D, and E can help improve liver health. And on the other hand, elements like iron, copper, and vitamin A can impact the liver negatively. They can deteriorate the liver's health. So, in case of iron, copper, and vitamin A, they should be taken in moderation. Not that they should never be taken, but they should be taken in moderation. Any iron, copper, or vitamin A above the recommended daily intake can accumulate in the liver and cause liver damage.
How can patients with liver failure maintain a healthy lifestyle?
So a patient with liver failure can maintain a healthy style by following the guidelines that they're being given at their clinics. They can also manage their stress properly and not tend to alcohol use or drug use. They can also adopt some lifestyle modifications that have been proven to increase liver health or promote liver health, and at the same time reducing damage to the liver tissue.
What challenges do you face in managing liver failure cases?
So the most common challenge faced in managing liver failure cases is compliance. So most of the times when you come across a patient who might need to do some lifestyle modifications, and in most cases it's usually alcohol use. So when you advise the patient to stop taking alcohol or to reduce the alcohol intake, there's most of the times poor compliance. Like the patient does not listen and stop. So this uh, doesn't uh, uh, doesn't improve the symptoms and affects the management. There's also dietary compliance, like when you advise the patient to maybe change their diet. Some people just don't want to change, or maybe some people are just not able to afford a particular diet that is recommended. And also, lifestyle modifications. There's also compliances, reduce compliance in some of the lifestyle modifications like weight management and uh, physical activity, and these directly impact the management of liver failure cases.
How do you communicate with patients and families about liver failure?
When communicating to a patient or the family with a patient who has liver failure, you have to help them understand the condition. So, and help them understand what the condition is, how the condition came about, and why they might be experiencing what they're experiencing, like the signs and symptoms. Help them understand the alternative management plans or the choices they have for a management plan, and help them choose the appropriate management plan for them. Doing this might increase the compliance to the management and to the treatment in general.
What advice would you give to healthcare providers treating liver failure patients?
So I'll start by encouraging them to keep up the good work. So they should not give up. They should stay up to date. They should check the recent researches on liver failure or related conditions, so that they should be able to provide adequate care. They should also try to encourage good provider, healthcare provider patient relationship. So, if there is a good relationship between the healthcare provider and the patient, there is good compliance to treatment and management plans.
All right. Thanks for your time.
Thank you.